National Electrical Code Article 517.18 requires hospital-grade receptacles in patient care areas of healthcare facilities. Patient care areas include operating rooms, intensive care units, coronary care units, and other similar areas. NFPA 99 Healthcare Facilities Code defines a patient care area as any space within a healthcare facility where patients are intended to be examined, diagnosed, treated, or given medication. Operatory rooms in a dentist office are considered patient care areas because patients are examined, diagnosed, and treated in these rooms. There is an exception to the requirement for hospital-grade receptacles in patient care areas. 517.18b states that hospital-grade receptacles are not required in areas intended for transient use by the public or in areas not accessible to patients. However, this exception would not apply to operatory rooms, as these rooms are accessible to patients. Therefore, based on the NEC and NFPA 99, the receptacles in dentist office patient care areas, including operatory rooms, must be hospital-grade. Hospital-grade receptacles are designed to provide a more reliable and secure electrical connection compared to standard receptacles. They are constructed with heavier-duty materials and undergo more rigorous testing to ensure they can withstand the demands of a healthcare environment. The specific requirements for hospital-grade receptacles are outlined in UL 498, the standard for safety for attachment plugs and receptacles. Some of the key features of hospital-grade receptacles include a solid brass mounting strap, corrosion-resistant plating, and a high-impact resistant face. The grounding contacts are also designed to provide a more reliable ground connection. The NEC requires that hospital-grade receptacles be identified with a green dot on the face of the receptacle. This makes it easy to identify which receptacles are approved for use in patient care areas. The installation of hospital-grade receptacles must be performed by a qualified electrician in accordance with the NEC and any applicable local codes. It is important to ensure that the receptacles are properly grounded and that all connections are secure. Regular inspection and testing of hospital-grade receptacles are also essential to ensure they are functioning properly. This includes checking for loose connections, damaged components, and proper grounding. If any problems are found, the receptacle should be replaced immediately. The use of hospital-grade receptacles in patient care areas is a critical safety measure that helps to protect patients and healthcare workers from electrical hazards. By understanding the requirements of the NEC and NFPA 99 and by following proper installation and maintenance procedures, healthcare facilities can ensure that their electrical systems are safe and reliable. It's important to understand the difference between standard and hospital-grade receptacles. Standard receptacles are typically used in residential and commercial settings where the electrical demands are less critical. Hospital-grade receptacles, on the other hand, are specifically designed for use in healthcare facilities where the risk of electrical shock is higher. The construction of hospital-grade receptacles is more robust, with features such as a reinforced mounting strap, corrosion-resistant plating, and a tamper-resistant design. These features help to ensure that the receptacle can withstand the wear and tear of a demanding healthcare environment. Hospital-grade receptacles also undergo more rigorous testing than standard receptacles. They are tested to ensure they can withstand high levels of current and voltage, as well as mechanical stress. This testing helps to ensure that the receptacles will function reliably in a healthcare setting. The green dot on the face of a hospital-grade receptacle is a visual indicator that the receptacle meets the requirements of UL 498. This makes it easy for electricians and maintenance personnel to identify which receptacles are approved for use in patient care areas. The NEC provides specific requirements for the installation of hospital-grade receptacles. These requirements are designed to ensure that the receptacles are properly grounded and that all connections are secure. The NEC also requires that hospital-grade receptacles be inspected and tested regularly. This inspection and testing helps to identify any potential problems before they can lead to an electrical shock. In addition to the NEC and NFPA 99, there may be other applicable codes and standards that govern the installation and use of hospital-grade receptacles. It is important to consult with a qualified electrician to ensure that all applicable requirements are met. The cost of hospital-grade receptacles is typically higher than the cost of standard receptacles. However, the increased safety and reliability they provide make them a worthwhile investment for healthcare facilities. In summary, hospital-grade receptacles are a critical safety component in patient care areas. They are designed to provide a more reliable and secure electrical connection, and they undergo more rigorous testing than standard receptacles. By understanding the requirements of the NEC, NFPA 99, and other applicable codes and standards, healthcare facilities can ensure that their electrical systems are safe and reliable. Here is a more detailed breakdown of the relevant codes and standards. Firstly, the National Electrical Code (NEC) is a widely adopted standard for electrical installations in the United States. Article 517 specifically addresses healthcare facilities. Secondly, NFPA 99, the Healthcare Facilities Code, provides comprehensive requirements for the safety of healthcare facilities, including electrical safety. Thirdly, UL 498 is the standard for safety for attachment plugs and receptacles. It specifies the requirements for hospital-grade receptacles. Now, let's delve deeper into the NEC requirements for hospital-grade receptacles in patient care areas. The NEC defines patient care areas as locations where patients are examined, diagnosed, treated, or receive medication. This includes areas such as operating rooms, intensive care units, and emergency rooms. The NEC requires that all receptacles in patient care areas be hospital-grade. This requirement is intended to reduce the risk of electrical shock to patients and healthcare workers. Hospital-grade receptacles are designed to provide a more reliable and secure electrical connection than standard receptacles. They are also tested to withstand higher levels of current and voltage. The NEC also includes specific requirements for the installation of hospital-grade receptacles. These requirements are designed to ensure that the receptacles are properly grounded and that all connections are secure. In addition to the general requirements for hospital-grade receptacles, the NEC also includes specific requirements for receptacles in critical care areas. Critical care areas are defined as areas where patients are subjected to invasive procedures or are connected to life support equipment. The NEC requires that receptacles in critical care areas be connected to an essential electrical system. An essential electrical system is a backup power system that is designed to provide power to critical equipment in the event of a power outage. The NEC also requires that receptacles in critical care areas be protected by ground fault circuit interrupters, or GFCIs. GFCIs are designed to detect ground faults and to quickly interrupt the flow of electricity to prevent electrical shock. Now, let's move on to the NFPA 99 requirements for hospital-grade receptacles. NFPA 99 provides comprehensive requirements for the safety of healthcare facilities, including electrical safety. NFPA 99 requires that all receptacles in patient care areas be hospital-grade. This requirement is consistent with the NEC requirements. NFPA 99 also includes specific requirements for the maintenance of hospital-grade receptacles. These requirements are designed to ensure that the receptacles are functioning properly and that they are not damaged. The maintenance requirements include regular inspection and testing of the receptacles. The inspection should include checking for loose connections, damaged components, and proper grounding. The testing should include verifying that the receptacles are providing a reliable electrical connection and that they are protected by GFCIs if required. Finally, let's discuss the UL 498 standard for hospital-grade receptacles. UL 498 specifies the requirements for the design, construction, and testing of hospital-grade receptacles. The standard includes requirements for the materials used in the receptacles, the dimensions of the receptacles, and the electrical performance of the receptacles. UL 498 also includes requirements for the marking of hospital-grade receptacles. The receptacles must be marked with the words hospital-grade or with a symbol that indicates that they meet the requirements of the standard. In conclusion, the use of hospital-grade receptacles in patient care areas is a critical safety measure that helps to protect patients and healthcare workers from electrical hazards. The NEC NFPA 99 and UL 498 all provide specific requirements for the design, installation, and maintenance of hospital-grade receptacles. By following these requirements, healthcare facilities can ensure that their electrical systems are safe and reliable. It is important to note that the requirements for hospital-grade receptacles may vary depending on the specific location and the type of healthcare facility. It is always best to consult with a qualified electrician to ensure that all applicable requirements are met. Furthermore, remember that the NEC is updated regularly, so it is important to stay current with the latest edition. The NEC is typically updated every 3 years, and each edition includes revisions and updates to the requirements for electrical installations. By staying current with the latest edition of the NEC, you can ensure that your electrical installations are safe and compliant with the latest standards. In addition to the NEC, NFPA 99, and UL 498, there may be other applicable codes and standards that govern the installation and use of hospital-grade receptacles. These codes and standards may vary depending on the specific location and the type of healthcare facility. It is always best to consult with a qualified electrician to ensure that all applicable requirements are met. In summary, the installation and maintenance of hospital-grade receptacles is a complex topic that requires a thorough understanding of the applicable codes and standards. By following the requirements of the NEC, NFPA 99, UL 498, and other applicable codes and standards, healthcare facilities can ensure that their electrical systems are safe and reliable. And to reiterate, patient care areas encompass any space within a healthcare facility where patients are examined, diagnosed, treated, or given medication. This definition is crucial for determining where hospital-grade receptacles are required. The operatory rooms in a dentist's office clearly fall under this definition, as patients receive examinations, diagnoses, and treatment in these spaces. The exception mentioned in 517.18b regarding areas intended for transient use by the public or areas not accessible to patients does not apply to operatory rooms. Patients are the primary occupants of these rooms during their dental appointments, and they are certainly accessible to them. Therefore, the requirement for hospital-grade receptacles remains in effect. Consider also the potential consequences of using standard receptacles in patient care areas. Standard receptacles are not designed to withstand the same levels of stress and wear as hospital-grade receptacles. They may be more susceptible to damage, which could lead to electrical hazards. Hospital-grade receptacles are specifically designed to provide a reliable and safe electrical connection, minimizing the risk of electrical shock to patients and healthcare professionals. The selection of appropriate hospital-grade receptacles is also important. There are different types of hospital-grade receptacles available, each with its own set of features and specifications. It is important to choose receptacles that are appropriate for the specific application and that meet the requirements of the NEC, NFPA 99, and UL 498. Remember to consult with a qualified electrician to ensure proper selection and installation. The proper grounding of hospital-grade receptacles is also crucial. Grounding provides a path for fault current to flow back to the source, which helps to protect against electrical shock. The NEC includes specific requirements for grounding hospital-grade receptacles, and it is important to follow these requirements carefully. Also, regular inspections of the electrical system in patient care areas, including the hospital-grade receptacles, are essential for maintaining safety. These inspections should be conducted by a qualified electrician and should include checking for loose connections, damaged components, and proper grounding. Any problems identified during the inspection should be corrected promptly. In addition to the technical aspects of hospital-grade receptacles, it is also important to consider the human factor. Healthcare professionals should be trained on the proper use of electrical equipment and the importance of reporting any electrical hazards. By promoting a culture of safety, healthcare facilities can further reduce the risk of electrical accidents. The information presented here is intended for educational purposes only and should not be considered a substitute for professional advice. Always consult with a qualified electrician to ensure that your electrical installations are safe and compliant with all applicable codes and standards. Keep in mind that electrical codes and standards are subject to change, so it is important to stay up to date with the latest requirements. The NEC is updated every 3 years, and NFPA 99 is updated on a similar cycle. By staying informed, you can ensure that your electrical installations meet the current standards and provide a safe environment for patients and healthcare professionals. The proper use of hospital-grade receptacles is just one aspect of electrical safety in healthcare facilities. There are many other factors to consider, such as the proper wiring of electrical circuits, the use of ground fault circuit interrupters, and the implementation of a comprehensive electrical safety program. By addressing all of these factors, healthcare facilities can create a safe and reliable electrical environment. And it must be stressed that neglecting the requirements for hospital-grade receptacles can have serious consequences. Electrical shocks can cause injury or even death. By investing in hospital-grade receptacles and following proper installation and maintenance procedures, healthcare facilities can significantly reduce the risk of electrical accidents.